Hi, I'm Dr. Leonard Friedland. I'm a pediatrician and an expert in vaccines, and I run a research laboratory at GlaxoSmithKline developing vaccines.
Very nice to know, Dr. Friedland. Thank you.
Well, cervical cancer is a cancer that begins in the cervix of a woman. There are two types of cells that cover the cervix, squamous cells and glandular cells, and they meet at something called the transformation zone. And the transformation zone is where cervical cancer starts. Now, normal cells of the cervix can slowly develop into pre-cancerous cells, which can eventually turn into cancer cells. There are two main types of cervical cancer, adenocarcinoma and squamous cell carcinoma. About 80% of cervical cancers are squamous cell carcinomas. The less common type is adenocarcinoma. The adenocarcinoma is developed from the mucus-producing glands in the cervix. There are many different warning signs or symptoms that women can have with cervical cancer. Now, most women, however, when they have early cervical cancer, they don't have any symptoms. But there are some warning signs that can develop, and they're pain during vaginal intercourse, bleeding after vaginal intercourse, or abnormal discharge of blood from the vagina when a woman's not having their menstrual period. Well, there are many risk factors associated with cervical cancer. They include age and genetics. For example, a family history of cervical cancer makes a woman 2 times more likely to develop cervical cancer than somebody who doesn't have such a family history. Now, the most important thing is that cervical cancer is caused by the human papillomavirus. If a woman has never been exposed to the human papillomavirus, they cannot develop cervical cancer. Now, virtually all women at some point during their life, if they're sexually active, they will become exposed to the cervical cancer-causing virus HPV, which means that basically all women are at risk for cervical cancer. Other high-risk factors, though, are for women who are sexually active with multiple partners, women who smoke, obesity, and a poor diet. These can all increase the risk of cervical cancer.
Are there any chemo prevention available for cervical cancer?
Absolutely. Vaccines are a type of chemo prevention, and vaccines have been shown to prevent cervical cancer caused by HPV types 16 and 18, which are the 2 most common types that cause cervical cancer. There are 2 vaccines available. Their names are Gardasil and Cervarix, and both of those vaccines have been shown to prevent cervical cancer caused by the 2 most common HPV types, 16 and 18. Well, looking more specifically at risk factors, men are not at risk of cervical cancer. They don't have a cervix. Generally, all women who are sexually exposed to HPV are at risk for cervical cancer, and virtually all women will be exposed to HPV once they're sexually active. Now, specifically, young women, African American women, women who are white or 17 years of age or younger when they had their first child, these groups are 2 times more likely of getting cervical cancer in the future than women, for example, who waited till after 25 before they had their first child. Women in midlife are also more at risk for getting cervical cancer. And women who don't go for annual Pap screenings are also more at risk for cervical cancer, as are women who, let's say, have emigrated to the United States from other countries where Pap screenings weren't available. Now, if we look specifically at the estimated number of new cases in 2012, statistically speaking, it's estimated that there'll be 12,170 new cases of cervical cancer in the United States this year, and 4,220 deaths. Luckily, cervical cancer can be detected by regular screenings with the Pap screening test. A screening is a test or an exam that can help find cancer in people who don't have symptoms right then and there. A Pap test lets women find out if they have cervical cancer, and if they do and it's detected at an early stage, it can be treated easily. Screenings can find those pre-cancer cervical cancer cells before they turn into full-blown spreading cancer. Now, where women do not have regular Pap screenings around the world, it's proven that the cervical cancer death toll is much greater in those countries. There are many different types of treatment for cervical cancer. The three main types are surgery, radiation therapy, and chemotherapy. Conization surgery removes a piece of tissue from the cervix to look at it under the microscope for cancer. A total hysterectomy is a type of surgery that removes a cancerous uterus and cervix. Radiation therapy uses X-rays to kill the cancer cells in the cervix to stop them from growing. And chemotherapy uses drugs to stop the growth of cancer cells by killing them or stopping those cells from dividing. Also, new treatments are always being tested in clinical trials, and people that have cervical cancer can participate in those clinical trials if they would like to. Now, all women should get follow-up tests after the cancer is treated to make sure there are no cancer cells that are remaining. The survival rate of cervical cancer depends upon the stage of the cancer, and a stage is looking at it under the microscope and seeing how severe the cancer is or how much it has spread. So a higher number stage signifies that the cancer is spread more widely. So for example, survival in stage 1A is 93%, while survival in stage 3A is 35%. And survival in stage 4B is only 15%. So it's important to find the cancer early at a lower stage, which increases chances of survival.
Dr. Friedland, it's my understanding that you have helped create a vaccine for cervical cancer. Can you tell me more about it?
Absolutely. My research team at GlaxoSmithKline has been working for years to develop a cervical cancer vaccine, which is now available all around the world and is called Cervarix. And the way we developed this vaccine is we looked at the science of what causes cervical cancer, which was the HPV virus, and created a vaccine that would essentially trick the body into thinking it was infected with the HPV virus, so the body would make its own antibodies and rev up its immune system, so that when it really is exposed to the HPV virus, it thinks it's already been infected. The body mounts its immune system and fights off that infection. In the cervical cancer vaccine, Cervarix has been shown to prevent cervical cancer caused by types 16 and 18. It's being used all over the world and is making a tremendous difference in saving people's lives.
Wow, that's very inspiring that you're helping save people's lives. Thank you very much for this interview.
You're welcome.